Во тема на денот, како што најавив, разговарам со представникот на Светската здравствена организација во Македонија, Аким Али. Welcome, thank you for being with us this evening.
A real pleasure to meet you. Thanks for inviting me to join you today.
The World Health Organization is usually making the headlines during global crises and pandemics, such as the swine flu 2008, the Ebola in 2019, and then the COVID crisis since 2020. But not all of us are following its work when it's not global crisis, but it's day-to-day work. And you are a leader in health and health organization research, even in situations when the challenges are not so global. So what health challenge is in your focus on today's Health Day, World Health Day, and what are you putting your focus on?
Oh, thank you. We really are celebrating women and children this year. And the focus really is ensuring that maternal health and newborn health is as optimal as it can be. Our theme is healthy beginnings, hopeful futures. And you would agree with me in any society that women can live long, healthy life, and during their reproductive years are able to give birth to children that would survive for a lifelong experience. It's fundamental, isn't it? Yes. And that's exactly what we are celebrating during this World Health Day.
The number that you have published, that one woman dies every 2 minutes in the world during childbirth or during pregnancy, is really scary. What are the countries supposed to do about this problem?
It's a big challenge. You're right, a woman dies every 2 minutes. We have over 300,000 deaths amongst women in and around pregnancy and childbirth. We even have reports of over 2 million deaths in young children from conception through to the first year of life. What's sad is that many of these deaths are preventable, and that's where the work we do in WHO with governments around the world become extremely important. We focus on making sure that women get prenatal care, that's during pregnancy, that they have the right support, they know when to seek advice, they know what questions to ask, and when the child is being born, that they have skilled birth attendants, usually midwives or people who have been trained in the community, and of course doctors who are able to treat complications when necessary. That's extremely important. But the childbirth itself is not the only bit that we have to take care of. We also have to take care of the minds and the mental health of the women after they've given birth, because of course there are possibilities of complications that would impact on their lives. Turning my attention to children themselves, making sure that children have the best start in life is important. Breastfeeding, exclusive breastfeeding for the first 6 months, making sure that growth and development of the child is monitored appropriately with support, and of course vaccination. We know that a lot of young children die from preventable illnesses that actually we do have vaccines for, including a very important one in North Macedonia that we're talking about, HPV vaccine. It prevents cervical cancer, which is another area that impacts on women in reproductive health across the world. And we really do need to do quite a bit more to progress this in North Macedonia. I must say that there's been a lot of progress, actually, in North Macedonia from those figures that we were talking about. I look at the data in 2016, we were having up to 10 deaths per thousand in terms of, now it's gone down by 80%. We are now at 2 per thousand. Best if we don't have any. But I think that shows us that doing the things that we know work, putting evidence behind our action, and making sure that every woman and every child, whether they're in Skopje or in the rural areas, whether they're of a particular ethnic group, have access to care is extremely important. And I think that's part of the work that we need to do with the government, and that's what WHO supports North Macedonia to do in the country.
Yeah, so there is improvement, but
Yes.
there is still some work to do so that these figures go in the positive direction, and
Yes.
we have
Yes.
less and less negative reports in this manner. Well, the World Health Organization publishes periodic reports on the status of the healthcare system in its member countries. What are the key challenges facing the Macedonian healthcare system according to your recent research?
We've been partner with the governments over the years, and I must say that the health system is a reflection of the journey that the country is going through as well. That transition into a matured state. And I think I'll start with a very important cornerstone, which is that we should have the right numbers and type and a good distribution of the healthcare workers. Mm-hmm. And that's a key challenge that North Macedonia is still dealing with. And that's both a combination of people emigrating, people wanting to stay in the urban areas when they're in the country, and also we have specialties where we don't have the right numbers of professionals trained. So that's one major area, the distribution of healthcare skills, the shortages in numbers that needs to be addressed. I think secondly also, undertaking some critical reforms about how we provide care is also another challenge, including making sure that people are able to get care closer to home. This, we call it primary health care, so the family doctors, the patronage nurses are available, and they are able to deal with things to prevent complications. So actually you don't need, the more complicated and more complex and more costly procedures and care. And so that is a critical piece of the work that still needs to be done in North Macedonia. I think it wouldn't surprise you if I mentioned the risk factors to diseases, because we know across Europe, not just in North Macedonia, what we call non-communicable diseases are increasing in numbers year on year. And by that, I'm talking high blood pressure, I'm talking diabetes, I'm talking cancers. And the unfortunate thing is that whilst a number of these are preventable, the risk factors have not always been fully addressed, particularly in terms of prevention. So smoking is a big one, a risk factor that increases your chances of getting a stroke. And stroke is one of the biggest causes of adult disability, when people are still supposed to be in their productive years. But if you have a stroke and you become disabled, then it's a bit of a big challenge. But it's also, a leading cause of cancers, respiratory illness, and long-term chronic respiratory disability as well. Alcohol is another one. And so preventive work in a more systematic, in a more scaled up way across the whole country, I think is an important part of the work that we need to do.
And I remember one report that your organization had about also mortality in the country and how people's health is affected by the air pollution, for example, which is a very significant number of people suffer from the fact that we live in a country with very high air pollution. For example, so probably that's one of the factors also.
I'm glad you raised that, and this is where the conversation we always have about health is connected to everything becomes extremely important. There's no wealth without health, and there's no health without wealth.
Yes.
You need both, and they have to go hand in hand. And in this age where the climate crisis and the environment and how we manage it become extremely important, we also have to take very good note of that. How we organize our transport, our energy use, the type of energy we use. Because of course, You're absolutely right. When the air is polluted, and you can't afford not to breathe.
Yes.
So, therefore, we have to be very conscious of how we manage the environment and the way in which we use the resources that are available to us. And this is an area that I know the Ministry of Health, wanting to work with Ministry of Energy, Ministry of Transport. We have other UN agencies who are also working in this area to form a collaboration to support the government and, of course, our communities. Because I think the behaviors within the communities are also important. Smoking is a big cause of air pollution that probably we don't think about, but also the way we drive, the way we burn energy, to heat our houses, but also the way we cook, and all of the other bits of that needs to be considered as well.
Yes, well, from what you have just said, it's very complex to achieve having a healthy nation, right? So it really touches a lot of sectors and a lot of how we live day by day.
Yes.
How do you cooperate with the institutions in our country? Is the World Health Organization telling the government where we need assistance and help and where we should focus? Or is it the opposite? Is the government asking from you in which sectors they need your help and you come to assist? Right. How does it work?
Right. WHO is a member state organization, which means every country. We have 194 member states as part of the family, North Macedonia being one. The starting point is we work on behalf of the member states. So we start with the priorities of the country, of course, with a global perspective, because we know from experience across the globe what are the big issues in terms of health. And then in each country, we look at the context, we work with the government of the day to understand their priorities within that global context. What is it that they want to do? What areas do they want to prioritize? And specifically in North Macedonia, it's a two-way street. The Ministry of Health would tell us, well, look, we think this is a priority area. We have some challenges in doing X, Y, Z about it. Can you, as WHO, help us, find the right partners, the right expertise? But also, can you help us mobilize the right resources to, do the work that we need to do? Sometimes we see an issue crop up in other parts of the world and say, oh, have you considered this? Yeah. Do you know this is going on? What's the context here locally? And if we can be of any assistance, of course, we support. We've been in the country for more than 30 years now, or thereabout, and we've actually got a very good relationship with the Ministry of Health and the government and all the other institutions working in healthcare to make sure that what we do focuses on priorities in the country.
So what does the collaboration for the next 4 or 5 years really will focus on, and what will it?
Oh, I'm glad you asked that, because actually we are just developing our country cooperation strategy, and this is a very good way to explain the answer to the question you just asked me earlier on. So we have the Ministry of Health working with us, leading that process of bringing all the partners together to first ask the question, what are the key issues today? What is the trend as we foresee them into the future? And then what do we need to do about it? And how do you prioritize the key steps to take? Because of course we can't do everything at once. So for us, over the next 5 years, we would tackle issues around immunization, making sure the coverage is high. We would tackle mental health amongst young people. We will look at issue of, unfortunately, violence against women and children. We will look at unintentional injuries from road traffic accidents to other injuries, which brings me to Kuchani, which is such a sad event that we pray never happens again. But preparing the country to be able to respond to mass casualty events like that, but also to prevent them is part of the work that we will do. To do that, I think there are sort of 4 really very important cornerstones for the work that we need to do with the government. One is to make sure that we have the right partnerships across all of the agencies, across all of the institutions, to focus on those big priority health challenges, bringing expertise, bringing complementarity. Then the second bit is all the critical reforms that we've just been talking about, primary health care, hospital care, regionalization, looking at work on non-communicable disease, including those risk factors that I mentioned from tobacco to alcohol. Making sure those critical reforms, that we put energy behind them, we accelerate and make sure it happens. And then that nobody living in this country is at a disadvantage when it comes to health and healthcare, from dealing with the fact that people still pay a tangible amount of money out of pocket, or the fact that rural populations might have challenge, or that actually we don't have specialized care everywhere. And we probably can't have that. But having a planned approach to do that is part of the work that we will do with the government over the next few years, picking the right priorities to support. And I think we're on a good journey in that regard.
I will finish where I started.
Yes.
When the World Health Organization is making top news in the world, one of that events, it was unfortunate for the organization, and that was the leaving of the United States from the World Health Organization.
Right.
How are you affected, and how much are you affected, and how much your work is going to change or suffer because of that decision of the American administration?
I mean, it is regrettable that we have that announcement from the current U.S. government. Undoubtedly, America is an important member state to the United Nations and to WHO. United States was part of the founding sort of membership for the organization, and also a big contributor financially.
Yes.
Both from the dues as a member that they pay, and also from areas of work that they've supported financially, and also with expertise. It's no denying that that would be very challenging for the organization, and our work has been about how do we make sure we prioritize the most life-saving actions that we've been taking, such that we don't lose that and we don't put more lives at risk. The unfortunate withdrawal of the US will definitely not be good for the world, and not for the United States, and not for any of our member states. Nonetheless, we have to learn to do less with less, but do it better, such that the areas of work that will be life-saving, from making sure we are prepared for emergencies to life-saving efforts like vaccination and care for young people, that we will just have to continue.
Well, Mr. Ali, thank you very much for being on Sitel's newscast this evening, and thank you for the work that you're doing.
Thank you so much. A pleasure to join you.
Thank you.
Thank you.